Hi, this is Dr. Bryan Baker. I'm the founder of the Spine, Hand, and Foot Clinic in Independence, Missouri, and we're talking in a series here about low back pain. We've kind of taken it from a downstream up standpoint because there's usually a cause and effect cascade of relationships that result in the symptom or pain that people come into the office with. And what we're trying to do is work back up through there to understand where's the pain coming from so that we can not only help you get over the pain at the moment, but also create a situation in which you're less probable to have continuing low back episodes in the future. We've talked about what causes pain, what has to be stimulated, that chemical receptors or mechanical receptors have to be stimulated in order for the message to reach your brain that says you have pain in your low back. Last visit, a couple of videos ago, we spoke about the chemical receptors. Now we're talking about the mechanical receptors. There's many types of tissue in your low back that can become worn out over time, and as a result of that gradual wearing out, things can become misplaced and therefore create compression or stretching on tissue, which causes pain and instability in the area, or reactive muscle spasm or reactive inflammation, all of which we've already learned can cause pain. Okay, so let's look at the tissue. Let's kind of break down the tissue in your low back into three primary types of tissue, and we'll break it down and we'll categorize it by its function. Okay, not by its normal anatomical names because you already know that, but by its function instead. We have tissue that is passive, we'll call that passive tissue. We have tissue that is active, we'll call that active tissue. And we have tissue that really controls aspects of the other tissue. We'll call that control tissue. Okay, so passive tissue, what is that? It's tissue that doesn't actually do anything on its own, primarily bone in your low back. Okay, ligaments also just hold on to things. They're not contractile. They don't contract and move things like muscles do. Ligaments just hold one bone to the next so that they don't slide out of place too far. Okay. So passive tissue, the tissue that doesn't actually do anything itself, is bone and ligament. The active tissue is primarily muscle, and the muscle is what moves everything around, right? Now, the muscle doesn't decide for itself, for the most part, where to move things, though, or how contracted to be, right? The muscle is getting stimulation from the nervous system, and the nervous system is what's controlling the amount of tone and the amount of push-pull in the muscle. So the nervous system is what's considered the control system of the body. Now, it gets feedback, and therefore it's an interactive process. It's not a master control system in the sense that we used to think, in that it controls everything. It's not really true. It interacts with everything and coordinates more than controlling. So I kind of hate to use the word control because I don't want to give that concept, but it's an interactive thing where the muscle maintains its tone because the nervous system thinks that's the appropriate tone to maintain, and therefore is giving the instructions to maintain that tone. So the muscle can cause pain, but primarily it's stretching or compression of the hard tissue on some other structure like a nerve that is now uncomfortable or painful. Okay, so the pain is, again, a stair-stepping kind of process. The hard tissue or the passive tissue doesn't actually decide to go compress something or to stretch something, but it can end up being in the position that it's in because of actions on it, like a trauma, a fall, an accident, injury, those kinds of things, or because the muscle is pulling things, or because over time of wear and tear and gravity, the bone begins to wear out the disc on one side, for example, and begins to move it like that. So anything that causes over time an inappropriate force on that bone, the bone changes position, and over time, the bones aren't sitting in there by themselves. They're connected to ligaments and they're connected to muscles. So as they move and compress, and they can compress, they can pull structures and create instability and therefore pain. So that's probably enough for this video. So we've talked about the tissues in your low back that could cause mechanical pain as being the passive tissues that don't actually do anything, but they get done too. Active tissues like the muscles, which actually do the action on the passive tissue primarily, and control tissues, which now tell the active tissues where to move the passive tissue. The passive tissue is frequently the thing that actually stimulates the pain. But if these other two things are accurate, are doing their job right, then this is less likely to cause pain. So we're going to go back and we're going to, on the next video, we're going to really concentrate on these two here, especially the control tissue that tells the active tissue what to do, which causes the passive tissue to do what it does. All righty.